Tuberculosis, or TB, is an ancient disease. It has plagued humanity for centuries. While often associated with the past, TB remains a significant global health concern. Millions of people still contract TB every year, and thousands die from this preventable disease. Understanding TB is crucial. It helps us recognize symptoms. Early detection enables timely treatment. This prevents the spread of the infection and also saves lives. This essay provides a comprehensive overview of TB. We'll delve into its causes, transmission, symptoms, treatment, and prevention. Knowledge is power. Let's empower ourselves with information to fight against this global threat. My name is Mystlc Health. I bet you didn't know that tuberculosis, often abbreviated as TB, is a highly infectious disease that has been affecting humans for centuries. It primarily targets the lungs, but it can also spread to other parts of the body, such as the kidneys, spine, and brain. The main culprit behind this disease is a bacterium known as Mycobacterium tuberculosis. This bacterium is incredibly resilient and can survive in the body for a long time. When a person with active TB coughs, sneezes, or even speaks, they release tiny droplets into the air. These droplets are laden with the bacteria. These microscopic droplets can be inhaled by anyone nearby, making TB highly contagious. Once inhaled, the bacteria travel through the respiratory system and settle in the lungs, where they begin their invasion. In the lungs, the bacteria find a suitable environment to multiply rapidly, leading to infection. The body's immune system usually mounts a defense against these invaders, trying to contain and destroy them. Often, the immune system is successful in containing the bacteria, preventing them from causing immediate illness. However, the bacteria can remain dormant in the body for years, lying in wait for an opportunity to reactivate. When the immune system is weakened, these dormant bacteria can reactivate, leading to active TB disease, which is highly symptomatic and contagious. TB is a serious condition that can cause severe health issues if not treated promptly. Symptoms include a persistent cough, chest pain, and coughing up blood. Fortunately, TB is both treatable and curable with a proper course of antibiotics. Early detection and consistent treatment are key to recovery. To protect ourselves and others, it's crucial to follow preventive measures such as wearing masks, ensuring good ventilation, and seeking medical advice if symptoms appear. Let's work together to combat this disease. Tuberculosis spreads through the air. It's not as contagious as some other diseases like the common cold or flu. You can't get TB from casual contact with someone who has it. Transmission usually requires prolonged exposure to an infected person. Sharing enclosed spaces with poor ventilation increases the risk. This is why TB is more common in crowded living conditions. It's important to remember that not everyone infected with TB bacteria becomes sick. Some people have latent TB infection, they don't have symptoms and can't spread the bacteria. Others develop active TB disease. They are contagious and need treatment. Early detection of TB is crucial for successful treatment and preventing its spread. Recognizing the symptoms is the first step. The most common symptom of TB is a persistent cough. This cough often lasts for more than 2 weeks. It may be accompanied by blood-tinged sputum or phlegm. Other symptoms include chest pain, weakness or fatigue, loss of appetite and weight loss, chills and fever, and night sweats. If you experience these symptoms, especially a persistent cough, it's essential to see a doctor immediately. Section 5. Diagnosis. Shining a light on a hidden enemy. Diagnosing TB involves a combination of tests. It starts with a medical history review and a physical examination. The doctor will ask about your symptoms, they will listen to your lungs. A skin test or a blood test can detect infection with TB bacteria. A chest X-ray helps visualize the lungs. It can show abnormalities suggestive of TB. Sputum samples are analyzed in a laboratory. This confirms the presence of TB bacteria. Early diagnosis is key. It allows for timely treatment. This prevents the progression of the disease. It also reduces the risk of complications. Section 6. The road to recovery. Treatment and the importance of adherence. Understanding the treatment process and the critical role of adherence is essential for a successful recovery from tuberculosis. TB is a treatable disease, but it requires a dedicated and consistent approach to medication. Treatment typically involves a combination of antibiotics taken over several months. This multi-drug approach is necessary to effectively combat the bacteria and prevent relapse. The exact regimen depends on the individual case, including factors like the patient's overall health, the strain of TB, and any potential drug resistances. It's crucial to complete the entire course of treatment as prescribed by your doctor. Missing doses or stopping early can have serious consequences. Even if you start feeling better, don't stop taking the medication. The bacteria may still be present in your body and can become active again if the treatment is not completed. Stopping prematurely can lead to drug-resistant TB, which is much harder to treat and requires more complex and prolonged therapy. This is much harder to treat and poses a significant public health risk. Directly observed therapy, or DOT, is often recommended to ensure adherence. This method involves a healthcare worker observing the patient taking each dose of medication. This strategy ensures patients take their medication as prescribed, reducing the risk of missed doses and incomplete treatment. A healthcare worker observes the patient taking each dose, providing support and encouragement throughout the treatment process. DOT improves treatment success rates significantly, ensuring that patients complete their therapy and recover fully. It helps prevent the development of drug resistance, which is crucial for controlling the spread of TB and protecting public health. Adherence to treatment is not just about individual recovery, it's about safeguarding the community. Section 7. Prevention is the best medicine protecting yourself and others. In this section, we will explore the various strategies and actions that can be taken to prevent the spread of tuberculosis, commonly known as TB. Preventing TB involves a multi-pronged approach that requires the collaboration of healthcare professionals, public health officials, and the community at large. It includes vaccination, public health measures, and individual responsibility. Each of these components plays a crucial role in reducing the incidence and spread of TB. Vaccination is an effective way to protect infants and young children from severe forms of TB. The earlier the vaccination, the better the protection against the disease. The Bacillus calmette-guerin, or BCG vaccine, is widely used across the globe. It is particularly important in countries where TB is prevalent. It provides some level of protection against TB meningitis and miliary TB, which affects multiple organs. This makes the BCG vaccine a critical tool in the fight against TB. Public health measures play a vital role in controlling TB. These measures are designed to identify and treat TB cases early, preventing the disease from spreading to others. These include identifying and treating people with active TB, ensuring they complete their treatment regimen to prevent the development of drug-resistant TB strains. Ensuring adequate ventilation in public spaces is another key measure. Good ventilation helps to reduce the concentration of TB bacteria in the air, lowering the risk of transmission. Promoting respiratory hygiene, like covering coughs and sneezes, is essential. Simple actions like these can significantly reduce the spread of TB bacteria. Addressing social determinants of health, such as poverty and overcrowding, is also crucial. Improving living conditions and access to healthcare can greatly reduce the risk of TB transmission in vulnerable populations. Vaccines, a shield against infection. The BCG vaccine remains a cornerstone of TB prevention. It's administered at birth or during early childhood in many countries with a high TB burden. The BCG vaccine is not routinely given in the United States. While the BCG vaccine is not 100% effective in preventing all forms of TB, it significantly reduces the risk of severe TB disease in children. Research is ongoing to develop new and more effective TB vaccines. These vaccines could provide broader protection against all forms of TB. Public health measures, ventilation, masks, and hygiene. Public health measures play a crucial role in preventing the spread of TB. Adequate ventilation in homes, workplaces, and public spaces helps dilute and remove TB bacteria from the air. Masks can help prevent the spread of TB droplets from infected individuals. This is especially important in healthcare settings and crowded environments. Good respiratory hygiene, such as covering coughs and sneezes with a tissue or your elbow, is essential. Properly disposing of tissues and washing hands frequently also helps reduce the risk of transmission. The global fight against TB progress and challenges. Significant progress has been made in the fight against TB. Global efforts have led to a decline in TB incidence and mortality rates. However, challenges remain. Drug-resistant TB is a growing concern. It requires longer and more complex treatment regimens. Access to healthcare and TB services remains limited in some parts of the world. Continued investment in TB research, prevention, and control programs is essential to eliminate this disease. Early detection, effective treatment, our best weapons against TB. Tuberculosis remains a global health threat, but it is a preventable and treatable disease. Early detection and effective treatment are crucial to controlling TB and saving lives. Understanding the symptoms of TB and seeking prompt medical attention if you experience them is essential. Completing the full course of treatment as prescribed is equally important. By working together, we can raise awareness about TB, reduce its stigma, and ultimately eliminate this ancient scourge.